To date, we've vaccinated over 13,000 individuals, and 10,000 of those are UW Medicine employees working in the healthcare setting, and another almost 2,500 of those are emergency medical responders and our external partners who are also in phase 1A. 2 of our hospitals are mainly vaccinating with Pfizer, and then we've got 2 hospitals that are vaccinating with Moderna. That being said, we started with Pfizer because Pfizer was out 1 week before Moderna, and so this week, our people that got their first Pfizer vaccine 3 weeks ago are now getting their second Pfizer vaccine. So doing one dose is a strategy that they've recently adopted in the UK as a public health measure to try to get more people vaccinated and to try to get some level of immunity in more people. Even after the first dose, by the time you're due for the second dose, there's thought to be significant antibodies developed that you do have protection. Typically, when you give a vaccine, there's a minimum interval between the first and second dose, not necessarily a maximum interval for many of our vaccines that we already use. And the reason there's a minimal interval is that you want your body to have time to create an initial immune response and then boost that response. We're waiting for some additional information here and data to be able to guide our practices. I think we'll get more data soon as information is continuously being acquired from these vaccine trials. But we are also waiting for our public health guidance to be able to make those decisions about how and when to give that second dose of vaccine, if not in the way that it's intended currently by our emergency use authorization. There's so few reactions that have occurred that are severe allergic reactions to this vaccine out of the millions who have received the vaccine so far. So that's the vast majority of people should not be concerned even if they have a history of allergies to oral medications or food, that they would have any issues with this vaccine. So we are still strongly encouraging those individuals to get vaccines. It's thought it's probably one of the components in the vaccine that is carried with the vaccine and not necessarily the mRNA itself, but we're learning more information about that. So that's why people who have had reactions to injectable medications or the mRNA vaccine itself, that's why that's a contraindication to getting it. It's hard, but be patient. We are working through, based on the recommendations we're receiving from the CDC, and really what we want to do with phase 1, what the goal of phase 1A is to maintain our healthcare workforce, as we're still seeing high numbers of people getting infected with COVID and our hospitals continuing to be full.